Rhinoplasty is the idea that we're going to treat the aesthetic deformities of the nose. The typical patient that comes in is a younger person that has a deformity to the nose, which includes a dorsal hump or the bump. They can also have, they could be too wide, or they could have a twisted nose, and in some cases they have a widened base. Also, some people come in with concerns about their breathing, which includes their septum or their turbinates, which we'll often treat at the same time as the rhinoplasty. The approach to rhinoplasty depends on the patient. Think about it this way: we have three different techniques. We have an open technique, a closed technique, and something that's in between called a hybrid. An open technique is a technique whereby we make a small cut inside each nostril, and they come together with an incision across the columella or the base of the nose. When we do a closed technique, which is a technique that doesn't allow for the incision across the base of the nose, the skin is left in place. We're able to deal with the dorsal hump, as well as some of the thickening or widening of the tip, but we can't address some of the more complex issues of some people's noses. For this group, the beauty of it is that the surgery is faster, and the recovery time is significantly shorter, and the swelling is far less. So in comparison to these two techniques, you can expect swelling in the open technique to last for up to 1.5 years, but in the closed technique, swelling is done within 6 to 8 months. I am always trying to do what the patient looks for. I try and make them fit into their own culture so that their nose is not some kind of cookie cutter pattern nose, that they all look the same. But in general, I always like a straight dorsum, or I remove the hump if I can, but I want it all to be balanced and fit the face.